In the United States, approximately 3% of people are diagnosed as having an intellectual disability or developmental disability, IDD. Individuals with IDD, like their neurotypical peers, have individualized healthcare needs and rely on healthcare professionals to meet those needs. However, unlike their typical peers, individuals with IDD have a significantly more difficult time accessing quality preventative healthcare and as a result experience higher rates of chronic health conditions. Evidence suggests that the greatest barrier to accessing quality healthcare for individuals with IDD is communication.
What is important to you about in working with a doctor?
That I do what they say.
I want to make my own decisions. I want to be informed about healthy decisions, but I want to be able to advocate for myself and for what I need.
Yeah, what makes it hard to understand?
It's just mostly the words and everything. Like if they're in the college and everything, it's pretty hard to understand them if they're in the medical terms. They really want to understand is that they got to talk to us. Probably, I would say more slow.
So that's why it's important for them to ask our patient, like, hey, do you need help understanding why you're here? Do you need help understanding why you need to get the test done?
Mm-hmm.
People can ask if we do.
One thing a doctor should do when working with people with intellectual or developmental disabilities is don't assume someone's stupid. Always give them the opportunity and don't look down on them and see the best in them.
In this training, you'll learn strategies to effectively communicate with people who experience IDD. The strategies covered in this training are research-based and have been proven to be effective in enhancing communication between persons with IDD and their healthcare providers. Benefits of this training include improved ability to communicate with people who experience IDD, learn how to develop a quality relationship with a patient who experiences IDD, and create an inclusive environment for patients who experience IDD. Most people communicate their thoughts or ideas using speech. However, for some people, verbal communication is a challenge. This does not mean that the person who is nonverbal is unable to communicate. Alternative forms of communication include sign language, picture symbols, writing, or a speech-generating device. Gestures, facial expressions, and body language are often used to communicate thoughts and ideas as well. If you need to include a parent or caregiver in the conversation, there are effective ways to continue to include the patient at the same time. Tips for effective communication. Establish rapport. Speak directly to the patient in an age-appropriate manner. Gain the person's attention using their name and gestures if needed. Determine how the patient communicates. And explain the purpose of the appointment in plain terms. Choose appropriate language. Use short, simple sentences and speak in a calm tone. Listen. Allow the patient additional processing time to comprehend verbal language. And allow the patient the time they need to communicate their needs to you. Explain clearly. Explain to the patient what you are going to do and why you are going to do it. Speak slowly and pause to check for understanding. Use handouts with pictures or demonstrate important concepts. In this video, watch how a provider uses these strategies in a medical visit with their patient that experiences an intellectual disability.
Hello.
Hello.
Good morning.
Good morning.
And you are Anna?
Anna.
Anna. My name is Ann.
Hi, Anna.
I'll be doing...
Seems like Ann and Anna.
I know, they're very close.
Very close. See, yours got N. Me, I got down A-N-N-A.
A. That's a very pretty version. I like it much nicer.
Much better.
Alrighty. I understand you're here today for your regular checkup?
Yes, I am.
You are. Okay. Okay. Do you have any questions or do you have any concerns right now? Is there anything that you that you've been worried about that you want to talk about?
No, not at the moment.
No. Okay. So what we'll be doing today is first, we'll do a brief physical exam. So what I'll have you do first is change into a gown, and then I'll be listening with my stethoscope to your heart and to your lungs and checking out the rest of your body, and then we'll go from there. So for right now, if I could have you change into the gown.
Sure.
Okay, great. So everything in your exam looked really good. Listening to your heart and lungs, everything was good. One thing I noticed that when I was going through your chart is I noticed that you've never had a mammogram before. And mammogram is something that women over 40 usually do, that we ask you to do. Have you heard the word mammogram before, or do you know what it is?
No.
No? Okay.
No, I don't.
So what a mammogram is and I have this brochure here so we can look at it. A mammogram is an X-ray picture of the breasts, and it's used to find tumors and cancer. If the cancer is found early, it's more likely to be cured, so that's why it's important to go, so that you get anything taken care of early. Some people ask if the test is safe because it uses an X-ray, and it is. So I don't want you to be worried about that.
All right.
Okay. And then for the test to be done, what they'll have you do is get into a gown, just kind of like you were this morning, just from the waist up.
Right.
And then you'll be asked to step up to a machine, and what you'll do then is they'll help you to put one breast onto a flat surface. It will probably feel cold. And then what they'll do is take another plate on top of it, and that will kind of compress your breast. It will squeeze it. And they'll ask you to hold your breath while the picture's being taken.
Right. Okay.
So can you tell me what what a mammogram is? What did you understand from them?
The mammogram is like when you do when they take the X-ray of the picture of the breast and everything. Then they will first you gotta feel your breast and everything, and then after that they put a gown on. Then you go to the X-ray place, and then they take the picture of it on either sides, and then bottom.
Bottom, yeah. And what might they ask you to do with your breath?
To take up, breathe in.
Yeah, breathe in and hold it. Yeah, just so that you're very still. Yeah. Okay. Do you have any other questions about that right now?
Nope, not at the meantime.
No? Okay. So our office can help you schedule that appointment for a mammogram. It's very important for women over 40 to do.
Right.
So that will be something that you'll be doing regularly from here on out.
Okay,
Okay, wonderful. Thank you.
you're welcome.
Let's reflect for a moment on what the provider did. Establish rapport and listen. The provider took a moment to talk with Anna before explaining the purpose of the day's visit. The provider adjusted her rate of speech to fit Anna's. Explain clearly. The provider described what she was going to do before she did it. The provider used plain language. When she used a technical term, she restated what she meant in words that were easy for Anna to understand. She first said, compress, and then said, squeeze, while using a gesture to explain the harder term. The provider used a handout with plain language and pictures as she talked to Anna about mammograms. The provider asked Anna to describe what a mammogram was to gauge Anna's understanding of the procedure. This technique is often referred to as the teach-back method. Preventative screenings. The provider checked to see if Anna was up to date on her age-appropriate preventative screenings. This is often missed with people with IDD. In this video, the physician skillfully engages a patient with limited verbal skills and his parent in the visit.
Hi, Colin. How are you? Dr. Woodard's going to be happy to see you. Okay. I've done everything I need to do here. So we're going to send Dr. Woodard in, okay?
How you doing, Colin? How are you? You know what, the last time I saw you, what was going on, do you remember? You broke your foot.
Okay,
I'm okay. Are you okay? You feeling all right? So how's your foot? That all recovered
Good.
completely? I mean,
Yeah.
that navicular, that's an unusual kind of
Move
fracture.
back.
I think, right?
It took a month.
Move back. Okay.
31.
Just gonna take a listen to your heart. Is that okay? And we may look at your ears and things. Okay.
Keep calling.
So what I'm gonna do is look in your ears. All right. Let's take a quick peek. Can I look at your other ear? Just like this? It doesn't hurt. See? I've got to do the looking. I'm afraid if you'll hurt yourself if I do that, okay? Hold on. Hold on. I'll let you look in my ear if I get to look in your ear first, okay? I'm not going to hurt you. There you go. Good job. Now you want to look at my ear? Hold on. Hold on. Look right in there. You're amazing me all the time.
Let's review the highlights of this visit. The provider greeted the patient using his name and spoke directly to him. He used a calm tone, used short, direct sentences, and paused to allow time for processing. He explained and demonstrated what he was going to do before he did it, and he obtained needed information from the parent while staying engaged with his patient. For additional resources, visit Surrey Place Center, MenCab has a toolkit and excellent free visual supports and resources for providers.